Welcome to VerifiedRx, your prescription for success. Brought to you by the Vizient Center for Pharmacy Practice Excellence.
Hello and welcome to VerifiedRx. Let's explore the first few weeks and initial experiences of the Medicare Drug Price Negotiation Program and the Medicare Transaction Facilitator, which supports the flow of data and payments. Joining us in this conversation is Dr. Jennifer Tussey, Senior Specialty Pharmacy Manager at BJC Health. We'll cover how to plan for managing this new program, how it's going so far, and what are some early challenges and resolutions for dispensers and providers in this first cycle of price negotiations. I'm Carolyn Liptak, Pharmacy Executive Director in the Center for Pharmacy Practice Excellence at Vizient, and your program host. Let's define a few terms before we start the conversation. The Medicare Drug Price Negotiation Program, or MDP&P, is part of the Inflation Reduction Act that was signed into law in August of 2022. This law allows CMS to directly negotiate with manufacturers the prices of certain high-cost single-source drugs that do not have generic or biosimilar competition. These drugs are selected through a statutory formula based on Medicare spend, the age of the drug, market exclusivity, and lack of competition. And these negotiations establish an upper limit or ceiling price known as the maximum fair price or MFP. The Medicare Transaction Facilitator is the operational backbone for ensuring the maximum fair price. It enables secure data and payment exchange among CMS, the drug manufacturers, and the dispensing entities. And it also ensures that Part D beneficiaries receive negotiated prices. Welcome to the podcast, Jen. Let's start with some background information about your health system and the pharmacies you manage.
Thank you. I work for BJC Healthcare. We're a large system in the Midwest. I'm only going to be speaking about the process in the East region. This is where I'm the Senior Manager of Specialty, Oncology, and our mail order pharmacy. Our impacted footprint in this region is large. We have about 12 pharmacies that we are currently managing through the MTF process. We do also have a West region. Their process I'm just not as familiar with, and we're still trying to get it off the ground.
Great. Can you please describe your organization's approach to this new program and how you're staying up to date on all of the information coming from CMS?
Yes, CMS did put out a lot of webinars at first, so we definitely started there. Also, we focused on having the right team. So starting with the managers, senior managers, and our director of retail pharmacy, we did a lot to learn about the program and begin that registration process. Then we transitioned into our vendor partnerships. We have a business manager within the retail sector who is an absolute whiz with Excel. He works really closely with a data analyst and our reconciliation technician to track all of the claims that we're sending, their current status, and then making sure that all of that aligns with the vendors we have. We have to determine some 340B eligibility, our expected payment, and if there are any inquiries needed. Then we have a pharmacy technician who works with our revenue cycle management to match payments and handle our write-offs. It really is a team effort to compile all of that data, and that's between the MTF system, Beacon, our data, our prescription data, and our 340B eligibility with the finance team. We do have a big team that is working together, but also making sure that those different systems have all the right information since it isn't streamlined at this moment using those really separate systems.
Sounds like there are a lot of complexities. And we know that enrollment began last June and what's required for all participants. Tell us about your experience with the enrollment process and some of your earlier conversations around plans and goals for implementation.
The enrollment process was one of the easier aspects of the program, getting signatures from all the entities, enrolling our revenue cycle management team as the remittance processing service, working with our director, our OPS manager, which is our outpatient systems manager. We worked to set up the feed with our revenue cycle management. And it's a little bit challenging for our revenue cycle management because they don't have access to all the data that we have. That's in MTF, that's in Beacon. So we had to use this collaborative team to make sure that we could get all of the data that we needed to our remittance processing services. That's where really focusing on our leadership and making sure that those dots were connected was so important.
So it sounds like enrollment was pretty easy. Then the complexity started. My understanding is that the flow of data and payments was a bit slow to start. How are those processes working now? Have you seen much improvement?
Flow of data is still slow. It has improved. Right now, we have about a 19-day window for MTF payments to be finalized. And at that point, we can bring any necessary inquiries. For the first few months, we were sitting at about 10% payment collection. Now we're closer to 60. At the beginning, our business manager was checking daily for updates. She has now been able to transition to a 2-week cadence. So every 2 weeks, she'll check a 2-week chunk of data that's about 45 days in the past. I don't know right now if that's going to maintain to be the best cadence, but it's obviously better than every day. One of the issues we've seen is lack of tracking of those inquiries. So in the system, sometimes we'll click a button saying that we have to start an inquiry. That's not always saved. We have to complete a lot of documentation and note taking on our own to make sure that we know what step in the process that we're at.
One concern that was expressed in advance of the go-live date in January was how inconsistencies with manufacturers' responses and payments would be handled if they occur. Have you experienced any inconsistencies, and were you able to resolve them?
Yes, the inquiries that I just talked about are where those come in. We are able to submit those, but again, we can't even begin to submit till at least that 19-day window is up, which is the average time that those payments are being processed. Then we have to document what's going on next. Start to finish, when there is an inquiry, payment can take up to 45 days. And that is with us making sure that we're doing that follow-up and checking in. They are being resolved, but it is a bit of a slow process.
And have you encountered any other challenges in addition to those types of inconsistencies?
Net profit can be really low with the standard default refund amount. So this is even considering that we've got wholesale discounts for being a large system. It could be really hard with smaller pharmacies and smaller systems because of the legwork that this requires to have such low reimbursement. And I know that's the story in pharmacy, but we do have a good FTE footprint to be successful here. And I do think that would be challenging if we were a smaller system.
Yeah, that certainly makes sense. Since your original start, you guys did some great work up front. Have you implemented any enhancements or made any operational changes along the way?
I wouldn't say any specific enhancements or changes, but it is ever evolving. As soon as we learn something, we tweak the process. Our business manager, her name's Anne, is incredible. She documents everything she discovers, everything that we've found out. We learned before that when you click the inquiry button, it doesn't always save the data, but that doesn't mean that that inquiry hasn't been started. So learning from that and implementing it as we move has really been the biggest change, is just learning as we go and tweaking to make sure that we're maintaining the most efficient process.
All of this has been great information, super helpful. Do you have any last words? What else do you think our listeners should know about the Medicare Transaction Facilitator?
Patience is a virtue. From my experience in pharmacy, a lot of our pharmacies and business analysts are very type A. We want to make sure everything is complete, answered. We want to check that box. But this is a process that moves slowly, and it needs patience and meticulous follow-up for success. And while not everyone needs the robust Excel skills of our team, it does help to note which claims do need attention. In a smaller system, you could certainly look up each claim for inquiries, but right now we're processing over 500 scripts at any given time, so that's not necessarily possible. So we did need this system to really pinpoint the problem scripts and the ones that we need to continually follow up on.
Thanks, Jen. That's incredibly helpful as well. We will be putting some links to resources from the CMS webpage in our show notes. Jen, have you encountered any other challenges that we haven't already talked about? And if so, how have you addressed them?
Honestly, a tricky one can be the financial aspect. So margins can be really low with SDRA, or the standard default refund amount. And this is even with the wholesale discounts that come from being such a large system. As I've talked about, we do have a good amount of people involved in this. And so with those FTE requirements that it takes to make this program successful, it would be pretty challenging for smaller systems to have this much time and energy put into it. That could definitely be something that's challenging.
Well, thank you, Jen, for joining us today to share your thoughts and experience and helping us understand this complex new program. It's been great chatting with you.
Thank you so much.
Subscribe today. Like us. Send us your comments. We'd love to hear from you. VerifiedRx is a prescription for success. and is brought to you by the Vizient Center for Pharmacy Practice Excellence. Thanks for listening.